Thank you, Speaker. Speaker, my question is to the Minister of Health. The Auditor General pointed out that Orange had logged some 60 public complaints and more than 500 staff concerns about patient care, delays in response times, and communication problems. The result? Patients were put at risk, and we have yet to find out how many deaths will be attributed to those decisions at Orange. And rather than seeing improvements, the front lines are telling us now that things are going from bad to worse. Orange continues to ignore staffing requirements for paramedics and pilots and continues to employ unqualified staff in their communications area. Would the Minister tell us why, after a scathing auditor's report, when he points out to these issues, and after 3 months of her new management team, we continue to get these reports about the lack of staffing and underqualified people at Orange?
Thank you. Minister of Health.
Well, thank you, Speaker, and thank you to the member opposite. There are big changes underway at Orange, Speaker, and I'm very proud of the work of our new leadership team. When issues came to my attention, Speaker, I took speedy action. The member opposite agrees that I have taken aggressive action when it comes to getting Orange back where it needs to be for the patients of this province, Speaker. We're bringing in new legislation, Speaker. We have a new performance agreement. We have strong new leadership at Orange. I asked the member opposite, will you support our legislation to increase transparency and oversight at Orange, Speaker?
Supplementary.
Well, Speaker, here's the fact. We've looked at the new performance agreement. Nothing has changed when it comes to the actual performance requirements. Those same requirements were in the old agreement. It was the previous management at Orange that intentionally lowered the staffing requirements to save money. Now we know it was because they wanted to pay themselves some hefty salaries and some bonuses. The Minister should know that those standards regarding the critical care, advanced care and primary care paramedics were there for a reason, so that they could respond appropriately to emergency calls. Those standards have not been restored. I'd like to know from the Minister, what has her new management team been doing for 3 months, if not to restore the qualifications of the paramedics who should be attending to those emergency calls? What have they been doing?
Thank you. Minister.
Speaker, this is an issue that I know that the new management at Orange is very much focused on. But the member opposite claims to have read the new performance agreement, Speaker. A lot has changed. Let me give you some examples. We will have a new patient advocate. We will have a complaints process that is publicly posted. We will have annual public surveys on performance. We will have improved reporting of emergency dispatch information by including cancelled and declined air and land ambulance calls. We will have a quality improvement committee, just like our hospitals do, Speaker, that post an annual quality improvement plan. The new performance agreement gives the Ministry the authority to conduct surprise audits and unannounced inspections. It links executive compensation to public performance improvement targets. It ties Orange's funding to key performance indicators.
Answer.
It gives the government control over Orange's corporate structure and sale of assets. Speaker, I could go on, but I think the member opposite, if he actually read the new performance agreement, would understand we're making aggressive change.
Are you going to support?